Hello and welcome to this weekly webinar series. Today to talk about physiology of yoga, we have with us Dr. Sailesh Kumar Goothy, who is Associate Professor, Department of Physiology, R.D.Gardi Medical College, Ujjain, Madhya Pradesh. आपका इस कार्यक्रम में बहुत बहुत स्वागत है सर. We also have with us Communication and Documentation Officer of MDNIY, Mohammad Tayyib Alam sir with us. आपका भी बहुत बहुत स्वागत है सर. Now, as per the tradition of our institute, let us start the program with prayers. Om Sahana Bhavatu Sahano Bhunatu Sahaviryam Karvavahe Tejasvinavadhitamastu Ma Vidvishavahe. ओम शांति शांति शांति. मैं आज के अतिथि वक्ता डॉक्टर साई शैलेश कुमार गूथी का एक बार फिर से स्वागत करना चाहूंगी, जो आज हमारे बीच फिजियोलॉजी ऑफ योगा विषय पर बात करने के लिए मौजूद है. आपका एक बार पुनः बहुत बहुत स्वागत है सर. साथ ही मैं संस्थान के संचालक अधिकारी मोहम्मद तैयब आलम जी का भी एक बार पुनः स्वागत करना चाहूंगी और अब उनसे अनुरोध करूंगी कि कृपया आज के अतिथि वक्ता का परिचय प्रस्तुत करें. सर.
Thank you, Dr. Vandana. Good evening, everyone. Respected Dr. Sai Sailesh Kumar Goothy sir is an associate professor, Department of Physiology, R.D.Gardi College, Ujjain. Dr. Sailesh has about 14 years of experience in the field of physiology. He's involved in the complete gamut of academic activities, such as teaching, research, institutional development, and training assignments. Dr. Sai sir has published more than 250 research articles in Index Journal. His area of interest is neurophysiology, yoga, and medical education. Sir has bagged the International Stress Management Award twice, the Young Scientist Award, including many awards in his credit. He is the principal investigator for many funded studies from various funding agencies. Currently, he is working on ICMR funded project in the management of Parkinson's disease. Dr. Goothy sir is a life member of the Society of Pharmaceutical Education and Research, Indian Association of Biomedical Scientists. Thank you, sir, for accepting our invitation for the Friday webinar, which is quite popular among the students and faculty of the institute, as well as the different social media handles. With these few words, I would like to invite our today's speaker, respected Dr. Sai Sailesh Kumar Goothy ji, to elaborate upon the topic that is quite relevant and excellent. And the topic is physiology of you, sir.
Thank you, sir. Thank you for the opportunity. First of all, my sincere thanks to the Institute Pradesh National Institute of Yoga for giving me an opportunity to share my ideas with you people. And special thanks to Dr. Vandana Madam for giving me this opportunity. So today I will be discussing about the physiology of yoga. Though the time allotted for this discussion is a little more, but I will try to concise as much as possible that we will gain maximum knowledge. Nearly 5,000 years ago, Canadian sage Patanjali explained yoga as a tradition and a system that controls body and mind in his treatise Yoga Sutra. Yoga is derived from the Sanskrit root yuj, which includes meaning of binding to and joining to. Yoga that integrates body, breath, and mind. Regular yoga practice make the subject experience good health, happiness, and also improvement in quality of life. Yoga is an ancient Indian way of life, which includes changes in the mental attitude, diet, and practice of specific techniques such as yogasanas, that is postures, breathing practices, that is including pranayama, and meditation to the highest level of consciousness. Yoga is a psychosomatic spiritual discipline for achieving union and harmony between our mind, body, and soul, and ultimate union of our individual consciousness with the universal consciousness. When a person practices yoga with a yogic attitude, this is most important. That is attitude of patience. That means you should not expect only that today practicing yoga you will get so much benefits. Not possible. Persistent practice, that is what required. So long-term practice is required in this. That how you should include in your daily, like daily we will take bath, like the daily we should do the yoga. So it should be our everyday practice. Then only we can expect a lot of beneficial effects by yoga. Overcoming obstacles within the self, that is trouncing laziness, anger, delusions, and desire for being different or better than others. There are several changes in physiology. Yoga is not only popular in India but also in Western countries. For example, Hatha Yoga has become most popular in North America in recent years. In India, the widely practiced yoga are Hatha Yoga, Raj Yoga, Jnana Yoga, Integral Yoga, Karma Yoga, Bhakti Yoga, Mantra Yoga, Kundalini Yoga, Sahaja Yoga, Laya Yoga, and many more. Hatha Yoga includes the practice of asanas, pranayamas, and kriyas, that is the purification techniques. Around 900 BC, the ancient sage Patanjali evolved the 8 stages of yoga, which is called Ashtanga Yoga. As such, integral yoga incorporates Hatha Yoga, meditation, and pranayama. In the Indian subcontinent, integral yoga is also known as the yoga of transformation. Yoga and homeostasis. So in physiology, we will use the term homeostasis for maintenance of internal environment constant. Yoga plays a key role by integrating different organ systems, and it will contribute for maintenance of the homeostasis and well-being of any individual, provided we practice it persistently. Yoga postures and breathing exercises largely contribute to stimulate homeostatic functions of the body through the regulatory activation of particular endocrine as well as nervous systems. For example, if you take the posture, head stand posture, it has a beneficial effect by acting through the master gland, that is the pituitary gland. Because when a person, when your individual is maintaining headstand posture, there will be a lot of blood supply to this particular gland. So, like that, every posture and every exercise and every asana will have a specific effect on particular organ system and contribute to homeostasis. Yoga and nervous system. So, in a study to assess the immediate effect of yoga breathing techniques on the performance of letter cancellation tasks, the authors reported that there was improved scores and fewer errors on the letter cancellation task, and suggested that yoga practice could bring improvement in the tasks which require selective attention, concentration, visual scanning abilities, and repetitive motor responses. All these are very important cognitive functions. Similarly, another study on the performance of participants on mirror tracing tasks found that yoga group had improved reversal ability, eye-hand coordination, which is most important cognitive function, speed and accuracy, which were necessary for the mirror tracing. Another study conducted to assess changes in the P300, that is the wave which is related to our EEG recording, the potential, brain wave potentials, following two yoga-based relaxation techniques, reported a reduction in the peak latencies of P300 after the yoga-based relaxation technique, and indicated yoga meditation enhances cognitive process underlying the generation of P300. Left-sided unilateral forced nostril breathing, which we commonly practice breathing exercises, led to right hemisphere dominance and improved spatial skills, while the maneuver on the opposite side showed left hemisphere dominance with improved verbal skills. So both spatial and verbal memory both are very important cognitive functions. So these things are improved not only in the healthy individuals but also in the disease conditions. Say example, I take conditions like Alzheimer's disease, Parkinson's disease. These patients will suffer mainly lack of the spatial skills, lack of the verbal skills. So if they could able to practice this yoga with long-term basis, So definitely they will be getting beneficial effect on improvement of the cognitive functions. Similarly, practicing asanas, pranayama, meditation, and satkas, that is a concentrated gazing practice, and attending devotional sessions for 10 days lead to a significant improvement in fine coordinated movements, which is very essential, especially diseases like Parkinson's disease. Yoga practice for a month not only led to a reduced degree of optical illusion created by Muller iron illness and increased the critical fusion frequency, but also improved neural performance, higher critical fusion frequency, indicating reduced fatigue and stress level. So this is the most important effect because nowadays, due to the busy lifestyle, everyone of us are undergoing a lot of stress. So yoga is a very good stress buster if you can practice it in everyday life. Effect of yoga on respiratory function. Pranayama practice stretches the lung tissue, producing inhibitory signals from the action of slowly adapting receptors and hyperpolarizing currents. So if you can practice yoga every day, like you make the yoga as your everyday routine, so ultimately yoga will help you to attain a state like parasympathetic dominance, which actually we require in our everyday life. We require to keep our autonomic system in such a way that the parasympathetic should dominate, sympathetic should be regressive. So yoga practice, everyday practice of yoga will help us to attain that state. Pranayama modified various inflammatory and deflammatory lung reflexes and interact with the central neural element to bring new homeostasis in the body. In a randomized controlled trial conducted on 57 adult subjects with mild or moderate bronchial asthma, there was a steady and progressive improvement in pulmonary functions, which is really a miracle that practicing yoga is helping as adjunctive therapy along with the routine therapy, whatever they are undergoing to improve these pulmonary functions in the patients with bronchial asthma. A study with the quest whether yoga could reduce the basic problem in asthma showed improvement on subjective measure as well as airway hyperresponsiveness to methacholine after Sahaja Yoga meditation. Yoga exercise group showed maximum improvement in the respiratory functions. In a setup of randomized double-blind crossover trial design, there was a significant increase in the dose of histamine needed to provoke a 20% reduction in FEV1 during yoga breath, but not with the control. Yoga group compared with the control group showed greater improvement in the scores for drug treatment, peak flow rate, and decrease in the weekly attacks of asthma following 2 weeks of yoga practice. In RCT conducted at All India Institute of Medical Sciences, New Delhi, India showed that adding a comprehensive yoga-based mind-body intervention to the conventional treatment improved several measures of pulmonary function in the subjects having mild to moderate bronchial asthma. A decrease in the exercise induced bronchoconstriction in the yoga group was observed when compared with the control group. Also, there is overall improvement in the quality of life. In a study conducted in US involving 22 participants suffering from chronic obstructive pulmonary disease, subjected to selected yoga exercise, including breathing exercise, meditation, and yoga postures for 1 hour, thrice a week for 6 weeks, showed statistically significant improvement for the St. George respiratory questionnaire, the vital capacity, maximal inspiratory pressure, maximum expiratory pressure, and thereby increased overall quality of life while practicing the yoga. In another RCT conducted at Brazil, the elderly health population had improved respiratory function and sympathovagal balance after yoga respiratory exercises. Similarly, effects of yoga on cardiovascular system. Cardiovascular system of the human body includes the heart and its arteries. Being isometric, yogasana rely on holding muscle tension for a short period of time. This improves the cardiovascular fitness and circulation. Many surveys showed that regular yoga practice may help the blood pressure to normalize. As an example, the stomach lift raises the diaphragm, which in turn massages the heart from below and strengthens the heart muscle, thus resulting in better circulation and less possibility of heart diseases. For example, Shirsasana, Sarvangasana, Viparita Karni, Mayurasana, and few pranayams especially influence the blood circulation. In a prospective cohort study involving 33 subjects with 30% and without 70% established coronary artery disease, subjected to a course of yoga and meditation, showed significant reductions in the blood pressure, heart rate, and body mass index. Another prospective controlled open trial, including angiographically proved coronary artery disease patients, showed yoga-based lifestyle modifications helped in regression of coronary lesions and also improved myocardial perfusion, which was translated into clinical benefits and symptomatic improvement. 6 healthy Asian Indian men and women who were trained in Surya Namaskar for over 2 years participated in a study showed that regular practice of Surya Namaskar might maintain or improve cardiorespiratory fitness as well as promote weight management also. An intervention study showed beneficial effects of short-term regular pranayama and meditation practice on cardiovascular function, irrespective of age, gender, and BMI in normal, healthy individuals. So that is the specialty of yoga because there is no age limitation, there is no gender limitation, and there is no BMI limitation. Anybody with healthy or any disease, they can be able to practice yoga to attain the beneficial effects of yoga. A study involving 50 healthy male subjects, 18 to 25 years age group, subjected to Mukta Bastrika, a type of pranayama breathing, training for 12 weeks showed an increase in the parasympathetic activity, that is reduced basal heart rate, increase in the Valsalva ratio, and deep breathing difference in the heart rate, and reduction in the sympathetic activity, that is reduction in the fall of systolic blood pressure on the postural variation. In a parallel arm RCT involving 67 sedentary office workers subjected to a 10-week worksite-based yoga program delivered during the lunch hour demonstrated improved resting heart rate variability and related physical and psychological parameters. So this study shows that a best example for those people who say that I cannot perform yoga because I'm not getting time in my busy schedule. So here you can see that these people deliver yoga during the time of the lunch hour. So if you have will to do the yoga, definitely you will get time, you will adjust your working hours, you will adjust your time to perform yoga in your routine day lifestyle. Effects of yoga on GIT, on the digestive system, it increases to GIT, which is very essential for the digestion as well as absorption of the food stuff, whatever we are ingested. Similarly, it stimulates the peristalsis, very, very essential for digestion, relaxes the digestive system and leads to more effective elimination, so there will not be any question of constipation. Effects of yoga on muscular system. On the skeletal muscular system, yoga increases the EMI activity is decreased. Also, the musculoskeletal flexibility and joint range of movement increases, which is very, very important, which is like diseases like Parkinson disease, where the range of the movement is very much compromised. In such patients, if you can able to improve the range of motion a little bit also, it is very worth for them by performing the techniques like yoga. Endurance, strength, and energy levels also increases in the muscular system. Coming to yoga and immunity, a study carried out on 60 first-year MBBS students randomly assigned to yoga group and control group. The yoga group underwent integrated yoga practice for 35 minutes daily in the presence of trained yoga teacher for 12 weeks. Control group did not undergo any kind of the yoga practice. So there is a decrease in the serum IFN gamma levels in the control group, where the decrease was not found in the person who performed the yoga group. So that is the effect of improving the immunity. In another study, yoga practice in patients suffering from pulmonary tuberculosis potentiated the body immunity and action of anti-tubercular drugs, thereby improving the sputum culture, radiography, and FVC, that is forced vital capacity, weight gain, and other symptoms. So yoga postures that twist and compress the organs will help massage and rejuvenate immune organs. Urmasana, which is the tortoise pose, which support the thymus gland, create specific benefits to improve the immune function. Yoga and diabetes. In an interventional research involving 98 subjects, found fasting blood sugar, serum total cholesterol, LDL, VLDL, the ratio between cholesterol to HDL and triglycerides were significantly lower, and HDL is significantly higher on the last day of the course compared with the first day of 8 days course. A comparison of yoga practice with a physical training showed that yoga practice of 6 months reduced the fasting blood glucose, lipid levels, markers of oxidative stress, while physical training also decreased fasting glucose but has fewer of the other beneficial effects. In a study of 44 type 2 diabetic patients were taught yoga and pranayama for 3 continuous months, 1 hour per day in the morning by a yoga expert had significant decrease in the fasting blood sugar, postprandial blood sugar, HbA1c, triglycerides, LDL, and to be controlled. Rejuvenation or regeneration of the cells of pancreas due to abdominal stretching during the yoga exercise, which may increase utilization and metabolism of glucose in the peripheral tissues, liver, and adipose tissues through enzymatic process. More active practices followed by relaxation ones lead to deeper relaxation than relaxing practices alone. Documented by research from Swami Vivekananda Yoga Research Foundation, Bangalore City, and the possibility of neuroplasticity, bringing about the changes in the hypopituitary pancreatic axis. Muscular relaxation, development, and improved blood supply to the muscle might enhance insulin receptor expression on muscles, causing increased glucose uptake by muscle and thus reducing the blood sugar. The improvement in the lipid levels after yoga could be due to increased hepatic lipase and lipoprotein lipase at cellular level, which affect the metabolism of lipoprotein and thus increase uptake of triglycerides by adipose tissues. Yoga postures can lead to improvement in the sensitivity of beta cells of the pancreas to the glucose signals and also improvement in the insulin sensitivity, which is the key factor which is deficient in the diabetic patients. In turn, can be due to the cumulative effect of performing the postures. Direct stimulation of pancreas also possible by regular practice of yoga. Regeneration of the pancreatic beta cell also possible by regular practicing of the yoga postures. Yoga and obesity, an observational study involving long-term yoga practitioners, showed that a consistent long-term hatha yoga practice in a non-probability sample of women over 45 years was linearly associated with the declines in the BMI even after correcting for non-yogic exercise hours and processed food consumption. In a study involving 60 post-menopausal women with more than 36% of body fat, divided into yoga exercise group and control group, the yoga group showed improved adiponectin levels, serum lipids, and the metabolic risk factors in obese postmenopausal women. A retrospective study involving 15,550 adults aged 50 to 57 years found that regular yoga practice for 4 years or more was associated with attenuated weight gain, especially among the people who were overweight. A week of intense yoga course reduced the BMI as well as waist and hip circumference, decreased total cholesterol, improved posture, and stability. In an RC involving 23 adults, the yoga group projected a 3-month intervention of twice-weekly yoga sessions and the education to receive health information every 2 weeks. At the end of the study, the yoga group showed improvement in the weight, blood pressure, and insulin when compared with the education. Yoga and arthritis, a randomized control study to evaluate the efficacy of integrating hatha yoga therapy with therapeutic exercises for osteoarthritis, showed that there was a significant difference within and between the yoga and control groups on all the studied variables with better improvement in yoga when compared to the control. In a pilot study involving 27 women with musculoskeletal problems such as osteoarthritis, subjected to undergo 8 sessions, that is twice weekly for 4 weeks, of a yoga program, indicated that post-study values of patients' gait parameters found to be statistically higher than their pre-study values. There was a decrease in the rheumatoid factor level along with the less pain and better function followed a week of yoga. Yoga and cancer. A new term, restorative yoga. This is a gentle therapeutic style of yoga that uses props to support the body to deepen the benefits of the poses. It is a soothing and nurturing practice that promotes the effects of conscious relaxation. This has been used to describe a gentle form of yoga that helps females with ovarian or breast cancer to reduce depression as well as anxiety and better mental health and overall quality of life. There was also a decrease in the fatigue. Yoga also helped patients with cancer to deal with the distressful symptoms and treatment-related toxicity of chemotherapy. Yoga could influence immune system, especially increasing the natural killer cells. Radiation causes DNA damage, and yoga practice could reduce that damage, which is caused by radiation. Yoga in medical education. So considering the importance of yoga, the apex body, National Medical Council, they have introduced the yoga practice in the foundation course 1 hour every day for a period of 10 days in all the medical colleges across the country. Yoga was introduced to the MBBS curriculum on 12th June 2022. So this should be considered as a golden day because including yoga in the medical curriculum is really useful for all the medical students so that they can train in the yoga and they can incorporate yoga in their everyday lifestyle because these students are the people who are undergoing high levels of the stress. So practicing yoga in everyday lifestyle will definitely help them to overcome the stress and improve their academic performance. So the common protocol for yoga was prepared by Morarji Desai Institute of Yoga under the Ministry of Ayush. So we have conducted a small research study. So I'm presenting that I found this is a good platform. I can present my results, what we have conducted in our department, followed by 10 days of the yoga program with my students. Total 150 students were part of the study. However, we can able to record all the values from 117 students. So this is auditory and visual reaction time what we have recorded from our students before and after the yoga practice. So everywhere you can see this, we recorded both right hand responses and left hand responses. This current table, what I am projecting is the right hand responses of auditory and visual reaction time. So auditory as well as visual reaction time both got decreased followed by yoga practice. Though the result is not statistically significant, but you can see the decrease in the improvement in the yoga program because this may be only 10 days program. So if they continue practicing yoga for more time, definitely there will be significant improvement in the reaction time. So reaction time is a wonderful cognitive function to test with because it assesses both sensory as well as the motor coordination. It requires sensory motor coordination. So that is the reason we selected assessment of the reaction time before and after the yoga practice. Also, we have collected the perceptions of the students about the perceived physical benefits. Majority of them accepted that yoga will lead to the physical benefits like body flexibility. It improves the physical stigma. It also helps in maintaining the optimum weight. And so perceived psychological benefits, majority of them agreed that it improves memory and it causes better relaxation and sleep, which is very much required for the student population nowadays, and reduces the anxiety and stress levels. Also, we collected details about perceived overall effects of yoga. Majority of them accepted that optimum fitness with balanced physical, mental, and spiritual health. Also, yoga causes overall sense of well-being, and it also improves their academic performance. And dominant perceived barriers in practicing yoga, they reported that lack of motivation for practicing yoga. This is what all those days, this is what happening. But nowadays, NMC itself considered yoga is very important and essential task. So they incorporated it in the curriculum. So every student of MBBS, they got a plenty of opportunity to perform yoga and to include yoga in their everyday lifestyle. So this barrier to overcome this barrier is will be very helpful for them. And motivation and future implications, majority of them said that yoga should be included in the health science education curriculum. So this is a positive move from the students from adding, they are very much positive to add the yoga in their curriculum and they are very much motivated to perform yoga in a group. They enjoyed the yoga and they were very happy that they reported that they will continue practicing yoga in everyday lifestyle. Coming to conclusion, regular practice of yoga offer considerable health benefits, including improvement in cognition, respiration, decrease in the cardiovascular risk, BMI, blood pressure, and improvement in immunity. So these are my references. Happy yoga. Thank you.
Thank you so much, sir, for this elaborative lecture. There are few questions in the comment sections. If you would allow, I would like to ask them.
Yes, ma'am. Yes.
सर, एक प्रश्न किसी ने पूछा है कि रिस्टोरेटिव योगा जिसके बारे में आपने बात की, अगर उसके बारे में अगर सरल शब्दों में कुछ बता सके तो। रिस्टोरेटिव योगा जिसके बारे में कैंसर के संदर्भ में जिसके बारे में आपने बात की।
Yes, 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 ma'am. So it is a gentle form of the yoga, madam. So which is actually nurturing type or soothing type of the yoga. Because cancer patient, if you go, they may not be able to perform the postures what exactly the healthy person perform. So they designed some simple soothing postures for the cancer patient to overcome especially pain. These will help them to overcome the pain, because these patients are undergoing a lot of chemotherapy and they're experiencing a lot of pain. So simple postures, whatever is designed, this is available in the internet, what exactly the postures are. So which will help them to overcome this pain especially. So, and also it improved them, it showed little usage of the painkillers. The use of the painkillers also reduced when you add up the yoga along with the regular therapy, what exactly they are getting.
Okay. Thank you so much, sir, for accepting our invitation and coming on board. Deliver such elaborative lecture. आपका बहुत बहुत धन्यवाद जो आपने हमारा अनुरोध स्वीकार किया और हमारे इस मंच पर इस प्रकार के व्याख्यान को देने के लिए उपस्थित हुए। आपका बहुत बहुत धन्यवाद। इसके साथ ही साथ मैं संस्थान के संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम सर तथा हमारे संस्थान के निदेशक महोदय डॉक्टर ईश्वर बसवरेड्डी सर का भी हार्दिक धन्यवाद देना चाहूंगी। साथ ही हमारी तकनीकी टीम और हमारे सभी दर्शकों का भी हार्दिक धन्यवाद जो आज इस कार्यक्रम के लिए हमारे बीच उपस्थित हुए। अब संस्थान की परंपरा के अनुसार कार्यक्रम का समापन शांति पाठ के साथ करेंगे। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। Thank you so much everyone. Thank you.